Happy New Year to you. I hope you had a safe time and a good time with family. I'm here with Paul and Josh, and the inimitable Rosa DeLauro will be joining us in just a few minutes. She's busy voting. And I'll give you just a brief update before Rosa comes on and gives you an update of what's going on in Congress in terms of the COVID relief money and things going forward. Let me just show you these numbers in brief. This is just a couple of days worth of numbers. I think what's of interest there is the positivity rate relatively stable at 5.29%. I say relatively, as I've said before, don't be a day trader. You probably remember on the 30th and 31st, we spiked up to 9%. We felt pretty, unhappy about that. We've come back down again. Our 7-day average is a little more than 5.3%. It's 6.6% because of some of those numbers. But it's worth remembering that even at 6.6%, we are probably the sixth lowest state in the country, thanks to you. Thanks for you being erring on the side of caution. And it's tough. I'm looking at New York, which is flared up. I think they're at 7.5 plus. Massachusetts, over 8%. Rhode Island, over 8%. So our neighbors, their 7-day averages are still a little bit more, which, as I've said before, we're not an island unto ourselves. That's why these numbers are worth watching. But so far now, more than a week since Christmas, we've still got relative stability there, still have good capacity in our hospitals. That number has not really gone up in the last 6-8 weeks. So I think steady as she goes in terms of those metrics. The new metrics, which we like to pay a little more attention to these days, more on the positive front, is the vaccine update. And we've got, through a lot of good pre-planning, working closely with our hospitals, working closely with CVS and Walgreens, planning for this. We're one of the first states in the country to get over 2% of our population with at least their first vaccine dose. And that is something we are following carefully, and I'll tell you how we're able to get those positive numbers. You can see the other states that join us, those with most likely to get north of 2% population is West Virginia, Montana, North Dakota, Maine, all of which are sort of small population states. For us, it's a little more complicated. It's a very dense state with a lot of people. We have to be very thoughtful about how you roll out the vaccine, get people notified, and make sure they can do it on a timely basis. And to date, working with hospitals and working with nursing homes, we've had pretty good success, and I thank our friends at Public Health for their efforts there. The update more broadly, we've administered about 75,000 doses. We've received about 167,000. So we're on par per capita compared to our peers in terms of the doses coming in, and we've done pretty well in doses administered. By the end of this week, by Friday, Josh feels very confident we'll have 100% of our nursing homes. That's patients and all the nurses that we can get to take the vaccine will have had their first vaccination. That's an amazing first start. Second doses, just to jump ahead there, start today for other people. So we're now beginning to catch up and complete what we had always anticipated doing for those first-tier responders. Soon, like today, we're going to be moving into the assisted living facilities, again, because those are people that are most likely to suffer complications, be that sometimes fatalities, sometimes going to the ICU or the hospitals. Very important we take care of folks there. 85 sites are now administering vaccines, and that's obviously hospitals, that's at the nursing homes. We're rolling that out to pharmacies over the next couple of weeks. So as we broaden our population, it'll be easier for people to get their vaccine on a retail basis right at their local pharmacy, Walgreens, CVS, you name it. Public health, federally qualified health centers. One of the things we're working on very hard to make sure doesn't happen in Connecticut, what you see happening in some other places, is a supply and demand disconnect. And you see sometimes the vaccines are sitting on the shelf and not being used and collecting dust. We're not letting that happen. With just-in-time inventory, we're being very careful. And if a hospital, we give a call, find out they have some extra vaccines, looks like they're not going to be used by the end of the day, we move that to somebody else in need. So we're going to leverage this as best we can. For updates all along the way, ct.gov/COVID vaccine, ct.gov COVID vaccine. That will give you updates on where the vaccinations are taking place alongside testing. A lot of our hospitals are going to co-locate vaccinations and testing, give you some confidence of where those places are. What is coming next? Well, I think as early as tomorrow, our allocation committee will be meeting. Allocation committee is the group that I'm working closely with CDC, the Centers for Disease Control down there in Washington, D.C., are going to allocate who comes after these first-line healthcare folks in the nursing homes and the hospitals. And we should be rolling that out over the next 2 to 3 weeks for the first step. And how we prioritize those essential workers. These are folks who can't telecommute, have to interface with people every day. That's what I'll be listening to from the allocation committee. They're going to be creating the process. Again, you'll be able to get that information at the website. Not like what you see here in Florida, which is you've probably been seeing some of the newspaper or TV clips on this. They sort of opened the doors. People waited in line for 8 hours. They ran out of vaccine after 4 or 5 hours. People left, came back the next day. We're going to do this online, and if you don't have online, make a phone reservation. Make sure the right people are getting the vaccine at the time that they've scheduled, and I think that will hopefully make sure that we've got the best group of people getting the vaccine on a timely basis. If we find we do have additional vaccine, we'll continue to open up the lens a little bit more, either in terms of age groups, demographics, or other frontline responders to make sure that every drop of that vaccine is administered on a timely basis. I don't want to leave anything to chance, and I don't want to leave anybody behind. And we'll give you more guidance over the course of the next couple of weeks on that. One last thing before I introduce Rosa. Today, kids are beginning to go back to school. And some are going back this week, some are going to wait a week. Many are picking up where they left off in December. And I just want you to see something that was highlighted to me, something that Miguel Cardona reminds me all the time, is you can see the red bar, those are kids who go to school in person. The blue are the remote days. And you can see that you're much more likely to be learning in classroom than you are not in classroom. You can see that disconnect. You can see the achievement gap is widened. More likely kids are left behind if they're students with disabilities. There you can see the blue, those that are remote learning, 85%. Those that are in-person, students with disabilities, 92%. Those with free and discounted meals, 86% if you're remote or logged in, meaning 14% aren't logging in, not getting that education, compared to 92%. It does make an enormous difference, and that's why President Biden was quite forceful in saying one of the reasons he wanted Miguel Cardona as Secretary of Education, do what we can to get kids back in the classroom. That said, we waited a long time, Rosa, for the CARES Act money. You had it passed down in the House of Representatives many months ago, and we are so appreciative the money came in, including a lot of money so kids can stay in school, remote learn, or be in classrooms safely. And I just want to say, you know, on a personal note, Rosa, you've been a great friend for me, a great friend for the state of Connecticut for an awful long time, and I could not be prouder on behalf of the people of Connecticut, and I'd say across the country, you're our chairperson of appropriations. That is a big deal. That's a big deal for Connecticut and Connecticut values in terms of how we allocate federal resources over the course of the next couple years and beyond. And Rosa's on the front lines there. And Rosa, I'd just love you to talk a little bit about the CARES Act, what has taken place, and what we can expect over the next few months.
Okay. Thank you. Thank you so much, Governor. It's a pleasure and honor to join with you. I thank you for the invitation. And I can see on the screen Josh Jabal and Paul Mounds, and hello to the two of you as well. And I thank you for your kind remarks, Governor. But most of all, we thank you for your leadership during what is an unprecedented time in our state and in our country. So listen, I am so honored to be a chair of the Appropriations Committee. And you know that we've already spoken. I said we would get together with you and with your team about what are the most important priorities for the state of Connecticut? How do we strengthen Connecticut's economy? And what are going to be the kinds of investments that are necessary for the future of our state? And I know you are waging a very important fight against the virus. And thank you for the compliment, because we do stand shoulder to shoulder in trying to deal with this fight. The bill that was before us with the CARES Act, look, we secured critical help, I believe, for the state and for the people of Connecticut. You also know that this is not the bill that the Democrats fought for, but I believe we have critical help that has been passed in this piece of legislation. It's an important first step forward as we think about where we go from here. We fought for, as you know, the additional 1,400 direct payments to ensure that individual received a total of $2,000, but that did not come to pass. And I'm of the Shirley Chisholm mode that you don't stand on the sidelines, wringing your hands and complaining, but we move forward with implementing what we have before us. We secured, as I said, this critical help. Each member of Congress may represent a vastly different district with unique challenges, but the effort was to halt the suffering. Those who have lost loved ones to the virus, stop the spread of the pandemic, provide a pathway to economic recovery, and deliver results for hardworking families. There's a new $600 tax credit that each taxpayer will receive, brings temporary relief to struggling Americans. A family of four would get about $2,400. Married couple can now receive $1,200, while a family of four with two children will get that additional $1,200, and or an additional $600 for each qualifying child. And in Connecticut, the CDC estimates that Connecticut should receive about $46 million in vaccine distribution funding and $205 million in testing and tracing funding. This is a start to additional funding. I believe that one of the first undertakings of the president-elect is that he will come to the Congress and ask for additional funding to speed up vaccine production and distribution. And it will be my goal and have every intention of ensuring that the funding will be there for that effort. So we secured some help in some other areas as well. All unemployment insurance UI programs have been extended to March 14th, extending the Pandemic Unemployment Assistance, the PUA, and the Pandemic Emergency Unemployment Compensation, PEUC, by almost 3 months. That provides our workers in Connecticut with nearly $2 billion to maintain the paid leave option, restores the enhanced federal unemployment insurance bump that provides an additional $300 per week for all workers who are receiving unemployment benefits. Small businesses in Connecticut finally getting additional help that they deserve. The Wall Street Journal reported that about 1 in 3 small businesses have closed their doors in Connecticut as a result of the pandemic. This is devastating for Connecticut's families and for our economy, which is why we were looking to a second round of the PPP loans. The new funding has dedicated $284 billion for very small businesses using community-based lenders and makes changes to support the smallest businesses, struggling nonprofits, and independent restaurants. If you need assistance, you can utilize a federally funded small business loan specialist at the Connecticut Small Business Development Center or the Women's Business Development Center. On several other fronts, we have our families who are struggling. We've seen the hunger lines in Connecticut, people lined up to get food. So hunger has skyrocketed during the pandemic. Families are being evicted from their homes as well. And much of this burden has fallen on local and state communities. We need to do more by making sure that heroes in our state and local government who are experiencing a budget shortfall, as only you can testify to, that what our concern is deterioration over the next several months. We need to have a strong and robust funding for state and local government so that we are not losing police, fire, teachers, and others because our communities cannot lose essential services. We need to take a look at education, and we are also proud of Connecticut and Miguel Cardona being the nominee for Secretary of Education. We know what great job he has done in our state. The relief includes funding for our schools in Connecticut through a stabilization fund framework. That was included in the CARES Act earlier last year. Connecticut should receive for K through 12 $494 million for K through 12. For higher education, $225 million. There's a lot in the package that entails specific rules, requires different processes to access the help. So the public should feel free to call my office for any questions or for any assistance. Those will be the priorities that guide the appropriations process as we start the new term. What we want to try to do, and we also passed at this time an appropriations package for 2021, and that information will be forthcoming to all of you. What we're trying to do is to make sure, because it's happened so late, that we can break down the numbers so we know specifically the dollar amounts that we are getting in Connecticut. I might add, with regard to the funding for food assistance, we increased the food stamp budget by about 15%. And that's about $13 billion in emergency food assistance. The issue again is, as we continue to speak, I will try to get the numbers on a much more granular basis so that you know, and you, Josh, and Paul know what is the specific dollar amounts that are going to Connecticut. I will just add this one more point. Governor, with regard to the education money, there is the 492 for K through 12. The governor's fund is $28.1 million, and the higher ed, as I said, is $225 million. Some of this funding goes by formula basis. Some of it will go directly to the districts in education. And we have to go, and I'm happy we will sit down, my staff will sit down with your staff and really try to go line by line as to which pot of money goes in which direction and where it is where it is housed. So I hope this is helpful, but you know, we're just at the outset of this process. And my goal is to be able to tell folks, and I know it is your goal, Governor, to be able to let people know how quickly and how soon we can implement all of this so that they can get the relief that they need. And let me close with that. Thank you very, very much for letting me be with all of you today.
All right, Rosa, thank you. You're the best. I love what you have to say. I love your rings. We got to see them on screen. Really good.
Listen,
And,
I'll just tell you this, Governor. I was first told, it may have been Senator Dodd who says anybody who has 6 rings cannot be elected to the United States House of Representatives. But we proved that one wrong. So there we are.
Rosa can stick around for a while, I hope, unless there's a call for a vote. And, of course, Josh and Paul are here as well.
NBC Connecticut.
Good afternoon, Governor. Today, the ACLU accused your administration of flip-flopping on prioritizing the prison system for the vaccine. The advisory committee gives you its recommendations. If the Department of Corrections is not part of the next phase, will you make the executive decision to add inmates to the list for phase 1B? Why or why not?
So far, what I've done is follow the lead of our public health experts. That, as you point out, is the CDC. And then we've got our advisory board. So I'm gonna follow their lead, leading with public health. I think they've been pretty good to date.
What is Connecticut's timeline for distributing the vaccine to healthcare systems and pharmacies who could administer the shots?
I'm sorry, I missed sort of the first part of that.
What is the state's timeline for distributing the vaccine to healthcare systems and pharmacies who can administer the shots?
I think what you're going to find is for the pharmacies, we get more into a retail type environment. We ought to see that over the next 2 to 3 weeks. I know we're trying to line that up right now so that we move into phase 1B, the groups that are outside of that initial healthcare first responder team. We ought to have that going within the next 2 to 3 weeks.
And have you set benchmarks for the number of people you want to see vaccinated each month? Are there any concerns that may hinder the state from reaching those goals?
Yeah, we don't necessarily control the supply chain. We're counting on what we get from Operation Warp Speed. So far, it's been pretty good, and I think, look, they were hoping to get a lot more vaccines distributed by the end of last year. They didn't quite get there, but they came a long way. We got our dose. You're going to see that ramp up quite a bit over the course of January. I think you know that it's our hope that all of those first-tier folks in the healthcare and the nursing homes have their second vaccine by late January, and that's how we start moving into H1B as well. How fast we get that whole next category, those essential workers, will depend upon the supply chain. I think we'd like to see that done by certainly the end of spring, knock on wood.
But you don't have a month-by-month goal?
My goal is pretty much what I told you. Do you have any more detail than that, Josh?
As the governor said, Kristen, it's going to be completely dependent on how much vaccine we receive into Connecticut from Operation Warp Speed. We will have the infrastructure in place here in Connecticut to get those doses into arms as quickly as they arrive.
Great, thank
Governor,
you.
let me mention this and to you, to Josh and to Kristen, because I try to inquire as to what we might know is coming just before I get on to this call. I'm told that there will be weekly allocations. In terms of numbers, I don't have any numbers, but I've been told it's that, that supply chain will provide weekly allocation. So that's as much as I know.
Thank you.
Thanks, Kristen.
Channel 3 Eyewitness News.
Yes, Governor, I noticed an interesting point that you made when it comes to extra vaccines. You mentioned that they get diverted to other places in need, so there's no waste going on. Can you give an example of that happening, and how often is this happening in our state?
I think not so much to date because we've really been allocating through the hospitals and through the nursing homes. But Josh, you want to talk through that a little bit as we move to phase 1B?
Yeah, that's exactly right, Governor. It's in early days of the program, so a lot of the local health departments, the hospital systems, they're feeling out, what their capacity is and standing that up. And so our team at the Department of Public Health is in literally daily, if not hourly, contact with those providers, making sure that the vaccine doses are being moved around the state to the place where they can most efficiently and quickly be administered. And so far, the team's doing a great job. Our healthcare system, got out of the gates very fast. Our local health departments, our federally qualified health centers coming online. And as the governor said, CVS and Walgreens have been phenomenal out in our nursing homes, conducting those clinics, finishing those up this week. And then they're going to begin to have capacity to start to turn their attention to their retail locations, later in the month.
And a quick question about the DPH cluster report. It shows that the virus transmissions, they're still kind of centered around the restaurants, the homes, the workplaces, and the childcare facilities. Could we see any action taken in response to that, or do the current guidelines suffice right now?
You want to start with that, Josh?
Yeah, important to note that those data are outbreaks that have been investigated. They make up a very small percentage of the overall number of cases in the state. So it's a little dangerous to read too much into that from a policy perspective because they make up a very small percentage of the total. There hasn't been a lot of new insight. The data that I saw reported on today were fundamentally very similar data to what was reported on about a month ago. So, the actions the governor took in phase 2.1, which I think were very helpful in flattening out, the number of cases and infection rate, hospitalizations over the last month and a half. No discussions at this point about any further changes.
And my final one on this, is there a plan to release that data more regularly?
No. I mean, it's as I mentioned, it doesn't change all that frequently. There's not a lot of additional clusters right now. When you have this amount of community spread as exists around the country, it's very hard, if not nearly impossible, for many people to be able to determine where they actually picked up COVID, right? So it gets increasingly hard to be able to trace those cases back to specific clusters. So it's, really focusing on all the basic public health guidance right now, wearing masks, staying away from large gatherings that the governor's been, very firm on throughout this crisis.
And as Josh points out, those clusters are a very small percentage of the infections out there. I always try to figure out what can I do with that information. One of the things I saw when it came to restaurants is the degree to which you see some infections there. Most of those seem to be related in and around the kitchen because you tend to be inside, close quarters, perhaps not wearing a mask as you should. So then you think, okay, what are the policy implications of that? Obviously, closing down indoor dining doesn't address the issue of the kitchens. You'd have to do indoor dining, outdoor dining, and takeout. So you have to think very carefully as you look at this data.
News 8.
Governor, your supply is only as good as the federal government. With second doses coming out, people are getting a little antsy when you hear President-elect Biden talking about, well, the government's not putting out as much as they thought they would. There's shortages, there's shortfalls. Have you seen any of that?
Not so much. I think, obviously there was some bureaucratic snafus during that first or second week in and around Pfizer. We've caught up on that. We're on schedule to get all of our phase 1 people done on time, on schedule. So let's give it a little bit more time. There's plenty of room for error, but so far I think they've done pretty well.
And then Representative Candelora today asked that teachers be put into the next group. How do you feel about that?
Teachers in the next group. Well, look, let me just listen for my allocation committee. Everybody has somebody they want to put into the next group, into the front of the line. Obviously, if everybody's a priority, nobody's a priority. But look, I can understand teachers in the classroom. They are frontline essential workers, so I can understand where that question's coming from.
Fox 61.
Hi, Governor. The CEA calling on the state to keep school districts remote through mid-January, especially considering the cases right now. What is your response to their request, and could we see that happen?
Look, as you know, we leave that up to local districts. I think some maybe are going to pause for a week. I think a lot others are opening up right now. You saw the numbers about how much more effective learning is and teaching is when it's done in the classroom. I think over the last probably 5 months of schools being open that a kid wearing a mask in a classroom is a lot less likely to infect or be infected than a child at home or playing with their pals in the neighborhood. So I'd like to think that, over the course of the next week or two, you're going to see the vast majority of our schools have an in-classroom option.
News 12 Connecticut.
Hi, Governor. You mentioned that the nursing homes should be 100% vaccinated, or at least 100% of the staff and residents reached by the end of this week. How many of the workers and the residents have agreed to take the vaccine? Do you know?
Yeah, 100% will have at least the option of having their first vaccine by the end of this week. I am told that the overwhelming of the residents are eager to get the vaccine and are getting vaccinated and will have their first vaccine. I understand there's a little more hesitancy when it comes to some of the nurses. Most are getting it, but not all. So we're doing a pretty aggressive public outreach campaign to address them.
And Governor, one more question about nursing homes. Two of the subcommittees that are deciding, what recommendations to make on nursing homes came out with kind of a preliminary list today. One of the things they're talking about is a special minimum wage just for nursing home workers to try to avoid the kind of big staff shortages they saw. Any thoughts on that?
Well, I can tell you what we have done is allocated, tens of millions of dollars, over $100 million for the nursing homes. In this last tranche, we really prioritize combat pay for those nursing homes, for those nursing home workers, those nurses who are showing up every day, and making sure that they receive a little extra compensation because they've deserved it.
And one of the other ideas they're pitching is a statewide visitation policy. A lot of the families say that the visitation rules can literally change from facility to facility. It gets very confusing for families. They want a statewide policy that that the facilities can't override. Any thoughts on that?
Well, I'll start and then quickly pass it over to Josh. But first of all, we follow the CDC guidance, which says there is visitation unless there are infections in the nursing homes. And if there are infections in the nursing homes, then the visitation is scaled back dramatically. And unfortunately, right now, there are infections in a vast majority of our nursing homes. Anything to add to that, Josh?
No, that's right. I mean, we're really operating under a set of requirements from CMS, the Federal Center for Medicaid and Medicaid Services, who have been very prescriptive about what visitation protocols should exist for nursing homes. We are hopeful, though, as we talked about, we're going to finish that first round of vaccinations in all nursing homes this week. We're really hopeful that as we get through this month, those numbers of infections, both in residents and staff, will really start to fall off, and this will become much less of a concern, within the coming weeks.
WTIC 1080 News.
Hi. How is the order of vaccination going to be determined when we get to the general population? How's that going to be broken down, or is that something that's in development?
That's in part what the allocation committee is meeting on tomorrow. That's in part why we listen to CDC and get their guidance based on experience in the other 49 states.
And Congresswoman DeLauro, I was going to ask you about the new Congress. Every new Congress brings in different kind of characters. There's a few Republicans who want to carry weapons while they're in the chambers. Your thoughts on that and any predictions for this session?
Well, I don't know about, let me start with it is a new Congress. Happy to have been sworn in yesterday with the newly elected members, all of them on both sides of the aisle, and having elected Speaker Pelosi. So it was a great day. I think that it has been made, clear to members who, there were a few who wanted to bring firearms to the floor of the House, but that was, immediately the security people have declared that is really not possible. That's why people go through metal detectors and coming through for detection of firearms. So we certainly cannot have members carrying firearms to the floor of the House.
And are you concerned about any disruptions Wednesday with the official count of the electoral vote?
Yeah, I don't quite know what to expect on Wednesday, except that the process has been laid out. There can be a challenge on a number of states, and each one of those challenges will be addressed. And there's a 2-hour debate limitation. We can see how much time each of them take. We could go to the early morning hours on Thursday. I think so much of what is we're looking at here is what underlies this, which is I think we all think about and care about, is that we haven't, certainly not myself, I haven't certified any elections, but we've had any number of legal entities that have certified the election of Vice President Biden as president-elect. We also have a constitution that talks about the peaceful transference of power. I think that is what underlies this effort, and we have to, look at it in terms of our democracy. And the governor has heard me say this, and certainly I believe Josh and Paul have, and others, that democracy is fragile. Sometimes we tend to think that nothing can ever disrupt it or remove it, but when you continue to, if you will, body slam it, then there has some serious repercussions to where our democracy going forward. That is what Wednesday will be about. Those are the issues that will be discussed. I know on our side of the aisle is the integrity of the process, the safeguarding, as it have been, of our elections. Our elections were safe, and we've had officials that can attest to that and who have withstood a challenge to that. And above all, our Constitution says that the American people should be guaranteed a peaceful transition of power.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, I understand that you want to wait until the advisory committee comes out and meets with their recommendations about vaccine distribution. But given the news that the UK variant was found in Saratoga, are you inclined, like some other governors have been, to try to add additional groups to phase 1B, like have people who are 65 and over rather than 75 and over, and add people who are under 65 with medical conditions that put them at risk?
Yes, Sue, that's a good question. Remember, if you put one group in the front of the line, other groups go to the back of the line. What limits us is not our intent to get as many people vaccinated as fast as we can. We've got the platform in place, the infrastructure to do that. What limits us is the supply of vaccines. So every time somebody says, put them in the front of the line, you're displacing somebody else. So you got to be careful on that. That's why I do tend to rely upon the CDC and our vaccine board. I think they're going to make decisions based upon public health and the greater good.
Has there been any evidence of the variant yet here in Connecticut?
Not that I know of, no.
And can you, I know this is off topic a bit, but can you talk about what Senator Carla Leone is going to do as special advisor to the commissioner, DOT commissioner? And what does that mean in terms of, how do we read that in terms of your transportation plan for this year?
Well, I know the new chairman of appropriations down in Congress pretty well. And I have a feeling that transportation and infrastructure is going to be a big piece of what you see in Washington over the course of the next, 4 years. And I want to make sure that Connecticut is ready. I want to make sure that we have our strategy in place. We have our design and build plans ready to go. And I can talk to my friends in Washington to tell us how Connecticut and our entire region can take advantage of transportation. Anything you'd like to add to that, Rosa?
Well, I would just say, first of all, on the prior question, I think using CDC as guidance for where we go. CDC, as it has in the past, whether it was Ebola or Zika, has always been in the driver's seat with regard to giving us direction and the scientific direction that we need. And we spoke, and the new administration has a high priority on infrastructure, something that is very near and dear to my heart, having introduced legislation in 1994 for an infrastructure development bank. And I think it's, in addition to transportation, you're looking at broadband, airports, water projects, et cetera. It is roads and bridges. And there is a heavy emphasis by the next administration on infrastructure. Why? Because it is a driver of the economy, and it results in jobs and in new technologies, for that matter, which helps to create jobs. I will be watching it very closely. As I said at the outset, the governor and I have agreed to sit down with his team and mine and lay out the priorities for the state of Connecticut. Governor, you'd be interested to know, and he had been so complimentary of you just a few days ago. I talked to Governor Cuomo, and we will take a look at what's going on in the region as well. We are interconnected here, and that we want to make sure that there is a high priority on infrastructure. And I applaud the governor for saying that Connecticut is going to be ready for what direction that we go in to take advantage of where this new administration and I believe the Congress. And I think there's opportunity for bipartisan support on infrastructure as we move forward.
Thank you.
The Day of New London.
Hi. My first question is, I guess for the governor, how is the state ensuring that the right people, for lack of a better word, are getting the vaccine?
Well, right now it's going through the hospitals, going through the nursing homes, so we know exactly who it's going to go through. For phase 1B, which are those essential workers, as you know, you sign up, it's by appointment, by reservation, you show ID. So we know that it is that first-line essential worker who's getting the vaccine, not their second cousin once removed.
Thanks. And then my understanding is that today the Department of Public Health put out some new guidance to local health districts and maybe some others related to eligibility for the vaccine. What are the details of that new guidance?
Josh, do you know that?
Yeah, I think it's just clarifying, some of the fine-grained details of population 1A. We talk about healthcare workers as being in phase 1A, but, it goes down, to a pretty fine detail of, other folks that could be in direct contact with people with COVID in a medical environment, like pharmacists or school nurses or home healthcare providers, dentists, laboratory staff, et cetera. So I think is helping to clarify that and also to set expectations once again for what the governor discussed with regards to just-in-time inventory, that our very clear expectations are that providers are only receiving that which they can administer within the next 7 days, and that we're going to be working very proactively with them to make sure that we're getting doses to the providers who can get the vaccinations done as quickly as possible.
Governor, if I can for 1 second, it touches on this area, and this is coming through the appropriations process. And what I started a year ago, 2 years ago, was that we need to build the infrastructure for our states in public health. One of the things that really occurred at the outset, just like we need to deal with the infrastructure for our departments of labor, because they were processing, and they still are processing, thousands and thousands of applications. And in many respects, not having to do that before, we watched systems crash. Well, the public health infrastructure, there hasn't been a serious investment in public health infrastructure for a number of years, which is why in the last appropriations bill, and I worked with the CDC to put in funding, and that's true in the case of the 2021 appropriations bills, to be able to give the states that capacity building so that in fact you can take on a pandemic or some such public health crisis. Without your systems crashing, without you not having what you need in order to be able to provide a safety and a health safety to the public. So we need to take a look at that aspect as well to make sure that we are investing in that kind of infrastructure as well.
Thanks. One more question for the governor. You mentioned that staff at nursing homes have been more reluctant to get vaccinated. Are you seeing that within hospitals as well? And does the state have plans to release data on the number of people who have been willing to get vaccinated within each of these phases?
We're following this very closely, Julia. I know more specifically regarding the nursing homes and the efforts we're making to reach out to the nurses there in terms of the safety and the efficacy of the vaccine. I think we're doing better at the hospitals, but I don't have specific numbers as regards to the nurses there.
The CT Examiner.
Hi, Governor. Thank you so much. Just want to ask a little bit more detail about the just-in-time inventory. So how exactly will this work? You have extra vaccines that aren't being used at a health center, and then, DPH transports them, or they're transported by the health district. Give me a little bit more nuts and bolts on this, if you could.
Well, I can start. I mean, back when we were very short in terms of PPE back in the spring, we used just-in-time inventory. We could monitor each and every one of those hospitals and clinics and nursing homes, making sure that they didn't have excess supply. We had to allocate that as we could, but get them the supply they needed to take care of the next day or two. So it's the same sort of theory as you have now with a vaccine. It's not like I have a big stockpile and we can just hand it out every time we need it. We're trying to maximize those doses that we get, those 50,000 doses every week, and make sure every single one of them goes. If it's a 5-dose vial, but we think we can get 6 or 7 doses, do that as well. That's how we're doing pretty well at maximizing the number of people who are able to get vaccinated with a limited number of vaccines.
Yeah, I would just add, I think the physical moving of vaccines from one clinic to the next is going to be pretty rare. Most of the work comes in on the pre-planning side, working with all the providers to know how many doses they can administer in a week so that they're only ordering and getting delivered exactly what they can deliver. So that's where we're working very carefully with them, and we don't expect to have to transport vaccine around within the state too much. But if we do, we have the National Guard is always on call, as they have been throughout this crisis, to step in and help in any way needed.
Thank you. And just one other thing. Last week, Governor Cuomo announced that he was imposing fines of $1 million and suspension of healthcare licenses for vaccine fraud. So what measures are being taken to ensure that the people receiving the vaccine in Connecticut right now are actually on that list of those eligible under Phase 1A? And would Connecticut consider something like the measures that Governor Cuomo has ordered?
I don't know, Josh. Sounds like a cure for which I don't know if we have a problem, but...
Yeah, that's right. I mean, I think our philosophy maybe is a little different in that we do put a lot of trust and faith in our provider community and make sure that we're communicating clearly with them about who's in line and who's prioritized, but give them the ability to move quickly. We don't want to wrap this process in a lot of, threats and bureaucracy so that we can go as fast as possible while ensuring we do have the right checks in place to, make sure that only people who are prioritized in that phase are getting access.
Great, thank you.
CT News Junkie.
Thanks, Max. Governor, I know you've spent a lot of time tonight fielding questions on different groups and when they might be vaccinated, but allow me to take another swing at it just because I think it's a group we maybe haven't talked about so much. Advocates for people with intellectual disabilities have some anxiety about where those folks may fall in terms of the vaccine rollout. Some recent studies have shown that they might be as much as 3 times more likely to die if they contract COVID than people without disabilities. Have you given much thought to where they should fall in this whole scheme of things?
Yeah, Hugh. What I can tell you is we thought long and hard about who's our vaccine advisory board, made sure that people there who are advocates for those with disabilities, intellectual disabilities, physical disabilities, and make sure that's a voice heard as those healthcare professionals help come up with the priorities for how we can maximize the use of the vaccines. Again, I'm going to rely upon their good judgment.
Yeah, and I'll add, Governor, you can't overexpress enough the importance of the diversity of not only professional background, but also personal background of the members of the allocation committee and the advisory committee as a whole. As the governor stated, we do have individuals who represent this community that you speak of, Hugh, directly on the allocation subgroup committee, and will be taking account all those related concerns and issues when they deliberate tomorrow before they put forth a final recommendation to the governor.
Yeah, thanks for bringing that up, Paul. Actually, that's one of the concerns I've heard from folks is that there's, for instance, nobody from DDS on that subcommittee. I think many of these people maybe feel that there isn't adequate representation on there. Who do you think, or who would you say represents that that interest on that subcommittee?
I would say directly Sarah Parker McKernan, who's from New Haven Legal Assistance, I would say that would be one particular individual. In addition, of course, we have many various individuals from the healthcare background who have worked directly with this community but that's the reason why we feel that's been a very diverse creation and group of the allocation subcommittee group, as well as all the other related groups, the communications group, as well as the scientific group as well. I think when we were one of the first states to put forth a group as comprehensive as this, where the recommendations is not just made by fiat by the governor, it's made from an educated standpoint, from a place of leading with science and public health, as the governor has stated from the beginning of this epidemic, and we're going to continue to do so going forward.
Okay, thanks, Paul. Governor, I have one other question. A few weeks back, some legislators called for you to use some of the remaining CARES Act funds to prop up the unemployment trust fund. At the time, you weren't a fan of the idea. I wonder if you're still opposed to that.
I think it's even worse idea now because we've got the right to use our CARES Act money. Thank you, Rosa. At one point, we had to have it all spent or invested or allocated by December 31st. Now I've got another year to do it. I've got high priority areas where that money can be invested and make an enormous difference. And at the same time, I'm able to borrow money from the federal government at 0% interest to shore up our unemployment trust funds. So I think that's the best way to handle that. And Rosa, if you want my 2 cents, I would take some of those loans you give us to the unemployment trust fund and turn them into grants. You know why? Because there's 49 other states that are out there borrowing now, and at some point, taxes on small business go up because you have to pay back those. I think you might be able to get a couple of Republicans to support you on that idea.
I think you're right, Governor. We'll pursue it.
All right, thanks, everybody.
The Connecticut Mirror.
Hi, Governor. Just following up on something that Julia had asked about. Is the state tracking the number of nursing home workers and nursing home residents who have received the vaccine?
I know we're tracking it broadly. I think we're tracking it by nursing homes. Josh, do you have better intel?
Yeah, we are expecting to get that split out from CVS and Walgreens through the federal systems. We don't have it yet, but once we have that data, we'll certainly share it.
At this point, you don't know the number of residents and workers percentage-wise who've been vaccinated so far?
That's correct. We don't have the split out yet. We get the total number, and we have some anecdotal feedback around, as the governor described, about the uptake between those populations.
Okay. And for the number of vaccines distributed, how recent is the state's data? Is it within the last 24 hours, 48 hours?
In terms of the number of vaccines administered that we reported out earlier, that's as of last night. So we pull the data first thing in the morning.
And can you talk about any hurdles the state is encountering in the rollout?
Well, I think, so far it's gone quite well. I mean, I think we've got a lot of our provider community, our hospitals, our federally qualified health centers, our local health departments who have been grinding for 10 months now with COVID response. And so this is one more thing added to their plate. And so, they've been doing an unbelievable job of, prioritizing resources and time to stand up vaccination clinics and to really ramp this up. They have to learn, new data reporting systems. There's a lot of work that they have to step up to. CVS and Walgreens have done a phenomenal job mobilizing dozens of mobile teams to go to these nursing homes, post up in their parking lots and go conduct these clinics. The speed with which they've mobilized and they're executing has been phenomenal. So overall, we're really happy with how things have gone. And as the governor said, hopefully the manufacturing capacity ramps up. We bring in more vaccine, we can accelerate things. The other thing I should mention is a big thanks to Congresswoman DeLauro as well for funds that were in the most recent bill to support vaccine administration. We're already talking about some ways to utilize that in the future when we get into phase 1B to get mobile units deployed into some of the harder to reach areas in communities that are in scope, but may have a harder time getting to one of these clinics, or where it's really important to bring that vaccination clinic directly into that community. So there's a lot of additional options that have been opened up thanks to Congresswoman DeLauro and a lot of the new federal funds that have come through there as well.
And could you just touch on, elaborate a little bit on the outreach and education for workers who are hesitant?
Sure. So, we're working with, the industry, with the 1199, a union that represents a lot of the nursing home workers. We cut a public service announcement last week that should be ready to go tomorrow, trying to get, workers talking to their peers, right, about why they're taking the vaccine, why they believe that it's safe. We believe that the data are so clear about how safe and effective the vaccine is that, it's really about making sure that people are hearing from folks that they know, that they trust. And so we're really, working with all the stakeholders, in the community to increase the outreach there.
The Waterbury Republican American.
Thanks, Max. Happy New Year, all. Do we have any kind of estimate on the total number of COVID-19 cases in Connecticut? I'm not just talking about the reported number. I mean, I'm talking about how many people in Connecticut are likely to have had COVID.
Got to get back to you on that, Paul.
There's been some estimations. I don't think anybody really knows the answer to that question, Paul.
Okay, so we've got 75,000 vaccine doses that were administered since December 14th. And you all are confident that that's going to be, you're going to stick to your original schedule based on these numbers so far?
Yeah, the governor, I think a month ago, forecasted that we'd be done with first doses for phase 1A by the end of January. I think we're very much on track for that. If anything, some of these milestones were, we had thought we'd get through the first round of nursing home vaccination clinics by the middle of January. We're gonna get that done by this Friday, the 8th, first week of January. So, things are going well so far, and we're as we've said a number of times on this call, if we do get access to more doses, we'll be able to further accelerate.
So it's about 50,000 a week, I thought I heard the governor say. Is that correct?
Yeah, as the congressman mentioned earlier, we get guidance from Operation Warp Speed kind of on a week-to-week basis, and for now we've been told to expect about 50,000 first doses a week. So we'll get second doses coming in on top of that, but 50,000 first doses a week.
And this is for the governor. The advisory group is just that, advisory. So this allocation subcommittee can come up with whatever recommendations they're going to come up with, but you're the one who's going to have to make the final decision on the distribution schedule and distribution priorities. What will guide your decision making, particularly if you decide to if you disagree with recommendations, say, you decide that people over 65 should be vaccinated as opposed to just people over 75 in this next coming phase?
Yeah, I'm really happy we got together this vaccine advisory board because, there's a lot of politics. Everybody's got a group that ought to be put to the front of the line. But to date, I find that CDC has put out some guidelines that make a lot of sense. I think, as you heard Paul talk about, I've got a really important, diverse group of people that I think represent not only public health, but also different interests out there. They put that together as a balance. And my inclination is to listen to them. I think their first priority is how can we make vaccines go that save lives and help protect the public health? And I think that's really important. And secondly, when it comes to essential workers who have to be able to get to work, can't telecommute, can't dial it in, make sure that they can get to work and take care of, obviously they're taking care of the elderly, let's say, when it comes to food, when it comes to daycare. I think right now the categories make a certain amount of sense to me, and I don't see any reason to upset the apple cart.
Okay, and in terms of future phases, I don't know whether you call them 1B, C, D, or 2 or 2A, will those decisions be made on a rolling basis, or will we get the final recommendation tomorrow from the allocation subcommittee?
Well, I think we have a little time on this because the essential workers, those frontline essential workers, the 1B group, is going to take us, months in terms of getting all of them with their first and second dose. More broadly than that, I think this spring you'll see probably as they look at other age groups as you go down, those that don't have comorbidities, those that we can do. And finally, it's young people. As you know, right now, none of the vaccines, at least to my understanding, have been deemed for people 0 to 17, 1 to 17. So that will probably be a category that's dealt with later summer, fall.
Okay. And just one last question on this $46 million that Representative DeLauro outlined for vaccine distribution. Do we have any kind of estimates on how much this effort will cost? A price tag on it? I understand, the federal government's picking up a large percentage of the share, but just wondering if there's a bottom line out there or bottom line estimate.
I think we're still working with Deirdre Public Health and the Vaccine Advisory Group, seeing in terms of it's going to get more complicated, Paul. I mean, right now we were able to do it to, big institutional settings like nursing homes and hospitals. When you get to the 1B and 1C and those narrower groups in terms of marketing to them, administering them, tracking them, I think the price does not go down. It goes the other direction.
Okay, thank you very much.
Connecticut Public Media.
Good afternoon. I believe it was last week when you announced where the federal funds were going to be distributed. One of them was to funeral costs. Spoke with some funeral directors today, and they said they've never had something come federal level, and were wondering how it would be distributed, and if there's a plan already, and if people who have paid for funerals in the past year might get reimbursed for some of them.
I'm talking about funeral costs.
Yeah, that's a really good question. I think I'm going to defer on that. Usually doing things retroactively, 6 months, 9 months, is probably more complicated. I think we're working with hospitals. We're working with, funeral homes. But look, there are a lot of people, over 6,000 have died, and we did everything we could to keep them alive. And if they pass, they have a right to pass with dignity. And I think that's what Congress was thinking, Rosa, when you put that item in there for the funeral homes.
Mm-hmm. Mm-hmm. Yes. Yeah. No.
I guess my question would be: has a plan been constructed yet of how the money's going to be distributed? Will it go to these funeral homes to distribute, to help with the families? Will there be an application process?
I'll stop in, Governor. That's still in the progress. As you probably know, that this is a new program that was created through Congress, but there are existing programs that we're working alongside with it, particularly with under Department of Social Services. So we'll be working with Department of Social Services and the Funeral Home Directors Association directly on that end. But one of the things the governor mentioned last week when he spoke about this is that not every funeral home is members of the association. So we'll be working with DSS in terms of how we can broadly get the information out once full guidance is provided to the state.
Governor, let me just say this because I know that we provided it, but let me just find out for you and for your folks what the congressional intent was and, what their thinking was in terms of the potentially administering this and how it would work.
No, thank you. That'd be helpful.
Sure. Be very, very happy to do that.
The Hartford Current.
Hi, everybody. First of all, I just want to clarify something because I'm hearing kind of conflicting things. Is the goal to have everybody in phase 1A have their first dose administered by the end of January or have both doses administered by the end of January?
Both doses.
Okay. Because I thought Josh had said something different a minute ago, but maybe I misunderstood. But because I was speaking earlier to somebody from one of the major health systems who said that he was confident they'd be able to do one dose by the end of January for all their staff, but wasn't sure they'd be able to do both doses depending on how many doses come from the federal government. But do you still have reason to believe that both doses is a realistic goal by the end of January?
I do. So far, so good.
So, I mean, the fact that one of the biggest health systems in the state isn't sure about that, you don't know what they're talking about?
Well, I don't want to. What I can do is count the doses that we've received, count the doses that are allocated to us over the next 3 weeks, look at our distribution system, count the number of doctors and nurses that are supposed to get it, and the numbers add up for the end of January.
Okay. I also wanted to ask about the new strain because there seems to be some emerging research that it might be more infectious in children than the strains that we've been hitting with so far. I know, Governor, that you've been a major advocate of kids being in school in person. Does that kind of research make you think twice about that, or can you see a world in which you would kind of change approaches depending on the research on this new strain?
Oh, yeah. No, if the facts change and research takes us in a different direction, absolutely. But the fact that it maybe or maybe not impacts younger people more still does not contradict the idea that being at home or hanging with your friends is somehow safer than being with a mask in a classroom.
Okay, thank you.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Hi, Rosa. Could you please give me your opinion on the president's phone call to Georgia and the possible ramifications in Congress?
Sure, I can. I think what we saw, what we witnessed there is that what the president was literally trying to do is he's on record as asking the Georgia Secretary of State, Brad Raffensperger, to illegally, and I quote, find nearly 11,000 votes needed for him to win the vote count in Georgia. I think that that in effect was trying to get state election officials to commit fraud. It's, as I mentioned a little bit earlier, his continued attempts to denounce what was a fair, legal, free election. And that has been certified by many legal entities. So that it would appear that the president doesn't know there are no bounds when it comes to overturning the results of the election. And that phone call was in his own words. And so lest you're going to ask me this follow-up question, I did sign on to a House resolution today with over 50 of my colleagues condemning the president's reckless actions. Again, our democratic process, our democracy is fragile. You can't just try to create distrust and degrade that process when the evidence is to the contrary. And it was the Georgia Secretary of State said to the president that his information was wrong.
And Rosa, so does that mean you'll support a censure then?
I have signed on to the resolution.
Okay, and when would that vote occur?
I'm presuming sometime this week.
Okay, thanks. Governor, could I ask you please, possibly your opinion on that also, since you've been a Trump watcher for a few years here?
I was struck, as Rosa just said, listening to those audio tapes, which are shocking. And unlike anything, I'm a student of history, I've seen in the course of 200 plus years of presidential history. But hearing that Republican Secretary of State and some young junior lawyer sitting them with the President of the United States on the phone for a full hour, and hear these folks say, Mr. President, that's not right. That's wrong, your facts are wrong, and I will not do that, gave me a lot of confidence in our fragile democracy.
Thanks. And Governor, could you get a little further into what Carla Leone might be doing over in DOT? Rosa's saying it sounds like that the commission will be spending a lot of time shuttling back and forth to Washington. Does that mean Carla will be kind of acting commissioner or liaison to the...
I wouldn't go that far, but look, he was chairman of transportation in the state Senate. We got to know him very well. And we've got to prioritize yet again our transportation initiatives and other broadly infrastructure plans. Make sure the designs, the numbers add up, ready to go, shovel ready, so that when Rosa gives us a green light, we're there, hopefully near the front of the line.
Thanks. And could I ask Josh a granular question? Is it too much to ask which health districts have gotten the vaccine, Josh, or is it just too many to count?
Yeah, no, I mean, about 40. So the majority of them are participating.
Okay, thanks a lot.
All right, I'm getting the signal. Rosa, thanks for joining us, and look forward to seeing you not on Zoom sometime. And congratulations again. We have a great friend there for Connecticut and Washington. And look, let me just take a break from COVID and a break from Donald Trump and talk about somebody who's no longer with us. Do you have that graphic? His name is Floyd Little. And Floyd was a graduate of Hill House High School right in New Haven. Not many guys in Connecticut are in the NFL Hall of Fame. He went on to Syracuse, where he wore number 44, same number as a guy named Jim Brown wore, so he's in pretty good company. Went on to the Denver Broncos and was an amazingly good person. Never had the privilege of knowing him personally, but I was talking to his nephew, Scott Jackson, the other day, who just reminded me what a difference a good person can make in people's lives. And Floyd Little, we're going to miss you. Take care, everybody. Nice to see you, Rosa.